We continue to follow that growing issue. Like we said, the opioid epidemic is impacting thousands nationwide. According to the CDC, in 2021, opioids caused more than 75% of deaths involving a drug overdose. Now, emergency response kits, including Narcan, are available for purchase over the counter at many pharmacies and are sometimes free through those local organizations. WFXR's Anna McDougall is live in Lynchburg for us tonight. She talked with Horizon Behavioral Health as well as first responders about the dangers of overdoses. Anna, what'd you find out today?
Drew, good evening. Well, like you mentioned, this opioid epidemic is happening across the country, and Virginia is no exception to that. The Virginia Department of Health reports that in just the city of Lynchburg, there were nearly 3 times more emergency department visits relating to an opioid concern in August of 2023 than there were in August of 2022. Now, people are hoping that having this Narcan over the counter could help save lives. Narcan is a nasal spray that can reverse the effects of opioid overdose and can now be purchased for around $45 without a prescription.
If everyday people in our community are committed to being able to respond in the event of an overdose emergency, we can prevent over 20% of deaths related to opioid overdoses, and that is a significant number.
Gabriella Smith is a certified Revive trainer with Horizon Behavioral Health. Revive is a training program that teaches individuals how to administer Narcan and help in emergency overdose situations, something she believes all people should be trained on.
It is so very important that everyone is prepared to respond in the event of an emergency.
Captain Eric Maskell with the Lynchburg Fire Department says on average, the department responds to 3 to 4 overdoses a week, adding that this is an increase from what he's seen over the last few years. Maskell says while over-the-counter Narcan can be a life-saving tool, he stresses that it is a temporary fix and medical aid is almost always still needed after they are revived.
Narcan itself binds with the opioid receptors and blocks the opioids from getting into the system, which releases the endorphins. The patient typically will wake up, and they'll wake up somewhat agitated. They could also wake up sick.
For this reason, he says you should always call 911 no matter the severity of the overdose.
I'd like to see just the opioid overdoses go down just because we're not abusing them or overdosing on them, but I think that having that over the counter is a good measure to have in place just in case something like that happens.
If you're not able to afford the cost of Narcan, you can also access it for free through some community organizations and health centers. Now, another thing to note that Captain Maskell did tell me is that if you are in an opioid overdose emergency situation and you do call 911, law enforcement will not charge you with any sort of drug charges. They do this to encourage people to call for help when help is needed. Live in Lynchburg, Anna McDougall, WFXR News.